Okay, so I explained this to people a few times, and it just makes sense. Like, so here's my opinion on health insurance. There's a bunch of things they need to do, but my opinion is there should not be a for-profit health insurance company.
Okay.
Like, they should all be what's called a mutual company, where 100% of the profits are actually retained for the benefit of the members.
Okay.
Right? Which means that Blue Cross could not have a $400 billion profit margin.
Right.
Right? So if you are paying insurance for the benefit of your own health, and the promise is that if you pay into this pool, you will access the benefits of health insurance, right? Then because of that very promise, that very relationship, it should be offered at the very best possible ratio of return, right?
Mm-hmm.
So ultimately, for that to happen, the concept of an insurance company creating a profit margin creates, like, you are paying for the profit margin.
Is that similar to some of these? I've seen some of these groups out now that are like group paying,
Healthshare.
Yeah, Healthshare kind of stuff.
So Healthshare, yeah, effectively a Healthshare. They're granted a license to bypass insurance. They become like an insurance. They're not insurance. They can't even use the same terms. They can't use deductible and copays, and they have to use share. You have to share pay and
right.
It's like they can't use the right terms because they're not insurance. And so there's a lot of, some people think those are risky. I've seen a couple of them collapse. But it's a similar concept. And they also, I think those exist mostly off of a religious exemption. So they have to have some sort of religious component to it. And so that's why most of them, are some, like, I've seen them pop up, and they're like, Christian care,
Right. I've seen some like Lutheran ones, and
you don't actually have to be Christian to join it. You just have to, it's Christian care.
But
it's a religious exemption. So it doesn't matter. I mean, like, I've talked to them, and they'll say, you don't have to be Christian to be a member of this. You just have to accept that this is a religious exemption healthcare group. And then you can, so I've seen a lot of them that do that.
But that makes sense. Like, especially if you're a health, care company, because, if you're marketing or looking for people who are, Christian or try to adhere to some sort of Christian lifestyle, that is going to automatically kind of put you into a.
So so what they'll do is being able to bypass insurance means they get to bypass the insurance laws after Affordable Care changed everything.
Right.
So Affordable Care required insurances to, a bunch of stuff that they would normally have just said no to.
Right.
Now they have to.
Right.
Right. And some of the things, so it used to be that you sign up for health insurance, they'd ask you all these questions. Trying to figure out, do you have any pre-existing conditions?
Right.
Right. Do you, whatever. And then, of course, there's a list of things they don't cover.
Yeah.
Right. Like, we don't cover all these very expensive things we consider unnecessary, or in some cases, we don't believe them, religiously, we don't believe in these things ethically. We should be covering those.
Yeah.
So we don't cover them. Right. Or whatever. Not religious. That's the Healthshare people. But insurance would say, here's a list of all the things we don't want to cover because it's too expensive and isn't necessarily for health so much as somebody who made bad choices in life.
Right.
So we're not going to cover that. Too bad, it's so sad. But now they can't do that. Now insurances have to cover all those expensive things, and they have to cover it even after you have those things, right? So not only are they, it's the double whammy of, not only do they have to cover them, they have to cover them if you sign up even after you already have the problem, right? And again, it's one that comes to mind is as rehab, drug rehab.
Right.
But it's in now, right? So, but wouldn't rehab being covered by insurance mean that you would have to have been not needing rehab before you, and then bought insurance and had it beforehand, and then developed the issue, and then ended up going to rehab to fix it using the same insurance that you had before you ever had the problem?
Right.
That doesn't happen like that usually. I mean, I think nowadays it's like people who need rehab buy it on, I don't know, I'm just assuming here, they could anyway, buy it on the exchange, and then go get rehab,
right?
Because they just bought it, and now they need it.
And then again, it goes back to like incentives, because all of a sudden now rehab centers, they're just like college, their tuition, their price is going to increase.